Okay, so we have Ed anesthetized. In starting the comprehensive oral health assessment and treatment, we've already done the history and oral exam. Generally it would be completed prior to anesthesia. The biggest thing that we need to do before anesthesia in regards to the oral examination is to do an accurate evaluation of the occlusion. And you can't do that with the endotracheal tube in place because the mouth doesn't close together and you can't assess the proper dental interlock. So that part's already completed. So what we're ready to do now is to get started with Ed. So the first thing that we're going to do is our full mouth radiographs. For the airway checks, before we get going, what we want to do is to make sure the shoulders are raised so that they're higher than the nose. Water tends to pool at the back of the throat, so this way it'll all come out into under the table. So we want to make sure the shoulders are higher. We've done a check of the cuff to make sure that it's adequately inflated. That's generally something that we should check every 20 minutes or so. And another thing that we're going to do is we're going to make sure that at the back of the throat we're going to pack with gauze. Okay? When you're new at this, that certainly is helpful to have string or ribbon on the gauze, just as a reminder to pull it out afterwards. Now, as far as the gauze, once we get water into the oral cavity, what we're going to do is we're going to make sure that we're changing it regularly. So for probing and charting, what we're going to do is we're going to use the Explorer as well as the periodontal probe. And what we're going to do is we're going to assess the gingiva as well as the indexes, including calculus, periodontal index, etc., for each tooth. So the instrument that I need to start with is our periodontal probe. Okay, and what I'm going to do, it's important to work in a systematic pattern. So what we do is we start at the front of the mouth in the first incisor in that quadrant. So this incisor right here is 101, and what we're going to do is we're going to gently insert the probe in the gingiva all the way around the tooth. So we're going to do the buccal as well as the palatal surfaces. Okay. Animals that have healthy gingiva, what you'll find is it tapers really tight to the tooth, which is good because that tells us that the gingiva is healthy. But the problem with that is it makes it very difficult to get the probe into the subgingival space. So what we're going to do, if that's the case, is just to kind of use your probe like this to catch the edge of the gingiva and then be able to insert it like that. Okay? When I'm actually assessing the periodontal pocket, what I want to do is to have the probe nice and flat against the tooth. And generally they say 4 to 6 spots around the tooth. Dogs typically have probing depths of 1 to 3 millimeters. But in a large dog, like a Great Dane, we can easily expect to have 4 or 5 millimeters, and that still be considered normal. So as I'm going along, what I'm doing is I'm looking at the calculus index of the teeth. I'm grading the gingival index surrounding the teeth. I'm looking for any frication, which is the exposure of the area in multi-rooted teeth in between the roots. And I'm also assessing mobility. Once I have an accurate assessment of gingival placement, like recession or hyperplasia, mobility, frication, etc., what I'm going to do is assign a periodontal index for each of these teeth. So what I'll do is also do quadrant 4. And again, once you get a bit more comfortable with the technique, you can move along quite quickly to get this done. Okay, so Ed's got probing depths of about 2 to 3 millimeters, which would be considered normal. In his history, he has had a periodontal pocket depth of 5 millimeters on the palatal aspect of his maxillary canine. So we really look closely each time we have him anesthetized to make sure there's been no changes. Okay, so again, keeping in mind you want to be very careful with the endotracheal tube. What we can do is just gently move its head up a little bit so we can accurately assess the lingual side of these teeth down here. Okay, so we're going all the way to the back, and then that's complete. As part of the probing and charting, what you also want to do is use your Explorer. And what the Explorer does is checks for any soft areas on the teeth. So this generally just needs to be done on teeth with a flat occlusal surface, like your molars. Okay? So again, when you poke it into the coronal surface, all right, on those flat occlusal surfaces, it should be nice and hard. There should be no sticky areas, and you shouldn't be able to catch anything as far as a little edge on there that shouldn't be there. So before I go ahead and start my scaling, what I'm going to do is do a rinse of Noble Dent. So Noble Dents is a brand name for chlorhexidine, and what chlorhexidine does, if you use it prior to scaling, is greatly reduces the amount of bacteria that's aerolized around the patients once we start scaling. Okay. So again, all the surfaces that I'm going to scale right now, I'm going to put a Noble Dent rinse on. The areas that I'm going to scale with the animal with Ed in left lateral is I'm going to do the buccal surface of quadrant 1 and 4, as well as I'm going to do the palatal surface of 2 and the lingual surface of 3. So as far as my scaling, my curetting, polishing, etc., those are the surfaces that I'm going to work on. So what I would do first is have a look in there and see if there's any teeth that have large deposits of calculus on them, and use my calculus removing forceps. So one in particular here is the maxillary canine. It's got quite a large deposit on there. So what I'm going to do is I'm just going to take the curved part, position it up near the gingiva, and just gently close them. And what that does is just kind of snaps off the calculus. This calculus is pretty soft, so it's not doing a nice little snap for us, but it is removing it. So again, you want to do that beforehand. The piezo scaler, your power scaler, will take it off, but what happens is you generally wear out your scaler a lot quicker, and you're using it a lot longer on the tooth, which generally heats up the tooth. So what I'm going to do now is I'm going to start with my piezo scaler, and this is for supragingival calculus removal. So I've already removed the large deposits of calculus. I have my Noble Dent rinse done, and now what I'm going to do is start scaling. So with the piezo scaler, it's the sides of the tip that are the active areas. So what I'm going to do is I'm going to use a small button machine, and just back and forth. There has to be lots of water on the scaler while it's moving. Otherwise, you're going to heat up the tooth. Generally, 10 to 15 seconds is how long you want to stay on the tooth. If you find there's still calculus after that amount of time, then you simply move on to another tooth and come back a little bit later. Okay, so that's probably long enough for that canine. So I'm going to move on to the first premolar behind it, do my scaling, and then I'll come back to that canine. So as far as the way that you're working on the tooth, it's a nice sweeping action. Generally you want to point towards the gingiva, but you'll find sometimes you have to change the direction of your piezo scaler in order to work with the surface of the tooth, okay? And that's not a problem, but you just want to make sure that you're never scaling with the scaler over top the gingiva like this, because that's very irritating to the gingiva. So I'm going to go back to the maxillary canine and do some more scaling. You'll find animals that have gingivitis certainly have a lot more bleeding than other animals, and that's just kind of a typical thing that we find. Usually nothing to worry too much about. Alright, so we're just going to keep working distally in the mouth. Again, I'm spending most of my time pointing towards the gingiva, but sometimes I'm going to change the direction of my tip, just because it makes it a lot easier to catch those areas. Okay, so again, working in the back of the mouth, use your other hand to lift the gingiva out of the way. Push that gauze out of your way so you can actually see the tooth that you want to scale, and keep moving forward like that. Okay, so right now it's just visually, I'm looking to see if I have all of the calculus off of the surface of the teeth. Okay, later on we'll talk about air drying, and that will help us figure out if we missed any calculus or plaque. So I will do the buccal side of these teeth. Okay, and again, this is quadrant 1. And then I'm going to do down here, which is a buccal surface of 4, caudal surface of 2, and lingual surface of 3. After I've completed the supragingival scaling with the piezo scaler, what I'm going to do now is use my hand scaler, and in this case I have a sickle scaler, to remove any deposits on the teeth which were in little grooves or little crevices that were just too small for my piezo scaler to get in there. One in particular is the developmental groove on the carnasal tooth. I'm just going to give it a little rinse, get that blood out of there. Okay. There. Sometimes there's little crevices right on the cusp of these teeth, little premolars or the incisors at the front. So we just want to make sure those are done. After completing the scaling, what I'm going to do is immediately change the gauze. It doesn't take a whole lot of scaling to get that wet. So again, have a look before I place any gauze back there. A little piece of calculus. You want to make sure you get rid of that before you put your gauze in there. Okay, so again, we've got nice dry gauze. What I'm going to do now is move on to my subgingival calculus removal. Okay, the instrument that I need for that is a curette. So whether I use a universal curette or a Gracie curette, it doesn't matter. Most of these instruments were designed for human teeth, so we really just have to pick one that works well with the shape of the tooth that we're working on. So supragingival scaling took care of all the calculus and plaque that were on the surface of the teeth that we could see. What we want to do now is use the hand instrument to get into the subgingival space underneath the gum line. We can't use our power scalers in the subgingival space because the water supply to the tip is compromised, and what that means is there's a greater chance that we can heat up the tip of the scaler, which will heat up the tooth. And in a lot of cases, if that happens and it's extreme enough, we can actually damage the tooth and kill the pulp and the nerve supply to the tooth. So what we're going to do is, again, start at the front of the mouth. Okay, so I have nice dry gauze in there. What we're going to do is take the face of the instrument, put it flat on the tooth as best we can, slip into the subgingival space, move my handle up, and come out. Okay? So when I'm curetting, I'm only focusing on the subgingival space. So it's important to have adequate control of your instrument, because when you come out, you just want to stop. You don't need to continue down the crown of the tooth. Alright, so again, just nice and gentle. Ed has lots of gingivitis here, which is why he's got a fair amount of bleeding when we're scaling and curetting. Okay, but that'll stop on its own. That's really nothing to worry about. Okay, if you're getting any deposits, pulling out plaque or bacteria, well, you wouldn't see bacteria, but plaque or any deposits, just wipe it on a gauze that should be in your other hand. Okay, so just like this. I find as we work towards the distal parts in the mouth, what we may need to do is actually flip over and use the other end of the instrument. If you look now, the toe of the curette is pointing towards the back of the mouth. If I flip it over and use the other end, you're going to see it's tilted in the opposite direction. And I find that works well as we start working in the back of the mouth, because there's certainly not as much room back there, and it's certainly a lot more difficult to see. So a lot of times it's by feeling us go down the crown of the tooth into that subgingival space. So that's how curetting should go. Okay, so next on our list is going to be air drying. Right now we're going to do detection of missed plaque and calculus. What this is going to do is we're going to dry the surface of the tooth, and if there's any calculus on there, it looks like a dry, chalky white substance. So what we need to do first is just rinse the tooth to get rid of any blood that may be on the surface of the tooth. Alright, so we're going to get rid of that. And then, being about 6 inches away, directing towards the front of the mouth, never like that, what we're going to do is dry the teeth. Okay, it's important to not go too close because you can actually direct air into the subgingival space, and there's a very small chance that you could create an air embolus, which we obviously want to avoid. So try to be further back. then after you dry them, inspect and see if there's any areas that you've actually missed. There's a little bit of calculus right there. Yeah, I think just right there. So what I'll do now is just turn on my power scaler. And it's nice because you can see the exact spot that you missed and just go over it. And then dry again to make sure you got it. Which we did, so that's perfect. Now what I'm moving on to is polishing. What polishing does is smooths any etches on the tooth that I've created by using my power scaler, as well as it removes plaque. Okay, so I've got some Profi paste and my little ring and my polisher. Again, this is a low-speed hand piece. So what I'm going to do is I'm going to start at the front of the mouth. Always make sure there's lots of paste in the cup of your instrument. So again, with these 3 little incisors, I'll just pick up this extra here, but I'm pretty much ready to fill up my cup after that. Okay. When you're polishing, it's important to use enough pressure that you see a flare in your cup. And what you want to do is just gently go right along the gum line, and what that does with the cup flare is actually directs it into the subgingival space. So when you're polishing, you may find you have to change the direction that you're actually using the polisher to get a better angle on the teeth. Okay, so again, with these larger teeth, you're generally maybe doing 1 at the most before you have to fill up your cup. The same 10 to 15 second rule applies. And again, because for Ed's gingivitis, we do see a little bit of bleeding, but again, that's nothing to worry about. Once polishing is complete, what you're going to do is rinse. Okay, and again, when you're in the back of the mouth, just use water, not air, as well. But as you get towards, the 4th premolar or so, you can press both buttons, and you'll get pressurized water. Okay, so that makes it really quick job to rinse that paste off those teeth. Alright, so there we go. And again, we're always being aware of our gauze in the back of the mouth. So again, it doesn't really take a whole lot before it gets all wet. Alright, so get rid of that water and then place your gauze back there. Okay, generally dogs too works quite nicely. Okay, last step before we're ready to wake up Eddie here is we're going to do our sulcular lavage. Okay, so sulcular lavage is going to direct Novodent into the sulcus. For this, it's much easier to start at the back of the mouth. A little bit of paste there still. Start at the distal aspect of the mouth. Okay, and what you want to do is just gently insert it into the subgingival space and gently drag forward while you're depressing the plunger. Okay, by doing that, what we're doing is we're flushing out any debris that may be left behind in the sulcus, especially Profi paste, because when we polish, we're right up against the gum line. All right, it's irritating if you don't do this step. They do write in journals that the gingival tissue does secrete fluid, so maybe we don't need to flush the sulcuses. But the chance that you're leaving polish in there is fairly high, so I think it's a good idea to go ahead and flush it out. Okay, and again, this endodontic needle is a 27 gauge needle, so again, it's a blunt tip. Okay, so again, I guess if you press hard enough, you could poke yourself really easily, but it's fairly blunt on the end. So that's the procedure for doing the work on the teeth that we need to do. So again, I've done scaling, curetting, polishing, sulcular lavage on the buccal surface of quadrant 1. All those same steps are repeated on 4, palatal surface of 2, and lingual surface of 3.